I now call upon our third speaker, Dr. Sonali V. Kumar, who is presenting on choroidal melanoma in young population is on the rise, experience from a tertiary care facility.
Very good morning to all of you. The paper which I am going to present today is choroidal
Please
melanoma
reset the timer.
in young population is on the rise. The incidence of choroidal melanoma worldwide is 5 per million and in Asian population is 0.5 to 0.8.
Sorry,
And
we cannot see the slides. There is some
slide is not the
yeah. और timer भी set कर दीजिए, please. Reset the timer for the speaker. Now you can start, ma'am.
Okay. So, incidence of choroidal melanoma worldwide is 5 per million and in Asian population is 0.5 to 0.8. It is considered to be a disease of elderly age group and common risk factors are advanced age, fair skin, family history of uveal melanoma and exposure to UV light. It's not moving. Most of the time it is not diagnosed on time as patients seek consultation when they develop sudden loss of vision. And further, the rate of diagnosis of this entity in young population is dismal. Incidence of choroidal melanoma is less common in the Indian population, and in younger population it is rarely seen as per various published studies. There are very few studies which have commented on occurrence of choroidal melanoma in young Asian population. Hence, this study was undertaken to raise awareness that this entity can occur in younger age group. So it was done at Army Hospital Research and Referral. It was a prospective observational study. It was done for 5 years and patients who were less than 30 years and diagnosed with choroidal melanoma were included. The consent was obtained in all cases. 12 patients were seen during the study period. Detailed history was taken. Investigations like FFA, OCT, B-scan and MRI orbit with contrast were done. PET scan was done to rule out systemic metastasis and details of the lesion were noted. At our institute, we formulated our treatment plan based on the basal diameter of the tumor and thickness. And enucleation we advise when the basal diameter is more than 18 and thickness more than 10 mm in size. All patients were followed up for 2 years. So, mean age of the population was 23 years. There were 2 male and 10 female patients, all had unilateral presentation. Right eye was involved in 5 and left eye in 7, and there was no family history of choroidal melanoma. Common clinical presentation was sudden loss of vision and elevated lesion with exudative RD. There was no sign of ocular and systemic association. Mean basal diameter of the tumor was 21 and the thickness was around 11. Common tumor configuration was dome-shaped lesion and pigmented tumor was found in 11 patients. SRF was noted in 12 patients. All had advanced stage of choroidal melanoma and histology showed epithelial type of melanoma in maximum number of enucleated eyeball specimen. So primary treatment modality was enucleation in these cases as the basal diameter was more than 18 and thickness was more than 10 mm in all cases. Implant exposure was seen in 2 patients. There was no sign of recurrence. None of the patient was found to have systemic metastasis at the time of presentation and no mortality was reported at the end of 2-year follow-up. So these are the common B-scan and the MRI orbit were the common imaging modalities. And these are the few cases of choroidal melanoma who were treated at our center. So our study has shown that choroidal melanoma in young population has increased as the mean age of the presentation was 23. So this was not in conformity with Shield et al. However, Biswas et al. They reported that Asian patients present with choroidal melanoma at a younger age group. The disease was found more common among females in our study, and this was in conformity with Singh and Shield et al. However, Conte et al. Reported like choroidal melanoma occurred more in men compared to females. The common symptom was sudden loss of vision, and the common sign was retinal mass with RD, and this was in concordance with Duper et al. In our case, in our study population, all the tumors were large size. So this was in discordance with Shield et al. As they reported smaller size of the tumor in younger population. None of the patients in our study group were found to have any risk factors. So this was not in conformity with seeing Shield et al. As they reported ocular melanocytosis was a common association. Histopathological examination showed epithelioid type of melanoma in our study population. This was in contrast to Rupert and Singh et al. As they reported mixed type of choroidal melanoma as the commonest type. So common treatment modality was again enucleation with implant, and this was in discordance with Duper et al. And Singh, as they offered various treatment modality to their cases in their study. So this study is the first study from Indian subcontinent which has exclusively commented on choroidal melanoma in young population. So main limitation was a small sample size and short follow-up period. And thirdly, the observation was made at a single center. Hence, the findings may not be the too representative of the population. To conclude, choroidal melanoma should not be considered as a disease of elderly people. The prognosis is abysmal if the lesion attains a huge size, and a high index of clinical suspicion is required to diagnose this entity in younger population and to achieve better outcomes in this age group. These are my references. Thank you.
Thank you, Dr. Sonali. It was a nice study and with good discussion. I just want to know, in literature, is there any known differences between the younger versus the older population melanoma presentation,
there are few studies.
histopathologically or clinically? Is there any difference?
There are few studies. They have commented like in younger population, the size of the tumor is small, and the prognosis is better compared to the elderly population.
Probably because they present early.
Maybe, but most of the time it is not considered. Like whenever we are seeing in our OPD also, like this disease is never considered. We always presume it will happen in the elderly age group. So
what was the vision like? Because younger population generally they are
Yeah,
aware that the vision
though
is
it's
dropping,
smaller,
and
but
they will not
they
say.
don't report because if it is doesn't involve their macula and all those, so they don't notice that there is any drop in the vision. When they develop, like all these cases which we have seen, all had advanced stage of choroidal melanoma.
What was the vision like at presentation?
It was hand movement close to face because there
And
was
the
a drop.
font size was so small. I guess you are not presbyopic, abhi, na? Isliye that's why you don't realize that it has to be.
So because that's why we
even
offered
from distance we couldn't read anything.
No, ma'am is asking about the presentation.
About the
font,
presentation,
not the
font
size of the tumor.
not the size of the tumor. We couldn't, we hardly could see anything, So font size should be at least, 24, 20, so that at least people can read. I guess it was very small,
And
Can you derive or can you think of any risk factor which might be associated with increased incidence of choroidal melanoma in young population?
like if there is a ocular melanocytosis or systemic any problem, these are the common risk factors which are associated with.
Any
For-
systemic association in any of your patient which you thought you should rule out?
Like dysplastic syndrome, nevus dysplastic syndrome. So this is the common risk factors which are associated with choroidal melanoma.
thank you, Dr.
And what
Sonali.
about the PET finding? Did you discuss? Sorry, I missed that.
We did PET scan in all the case. We didn't find any sign of systemic metastasis.
Okay.
Last thing, just to finish it off, you have just skipped the slides ki, like more than in 18 basal diameter, you did the enucleation. And what was the second, like it must be in concordance with the COM study or something, like in the small, medium, what do you
As
do?
per their study, like if the size of the tumor is less than
No, in your case, what
like
did you,
in
what is your
our-
protocol?
like in our cases, like in this study, all had advanced stage of choroidal melanoma, so we
Okay.
couldn't offer globe salvage treatment.
In younger patients, I mean, although you have already mentioned the vision was very poor at the time of presentation, have you considered GKT or any globe salvage therapy in these younger individuals? Or just
if
straight
they
away
report,
enucleation?
If they report early or tumor is of smaller size, like we have other facilities also.
But in large tumor also, we have two options. Like we can go, if the patient wants, then we can go for globe
No,
salvage GKT.
if the size of the tumor is more than 18 and the risk of systemic metastasis is very high. So in that case, we should not take any chance because they are younger age group. So we can increase the longevity of this patient by enucleating the eyeball instead
Yeah,
of
in GKT there is a
exposing
22% chance
in
of the
spite of
systemic
offering the
metastasis.
globe salvage
Okay.
because it's not going to help them.
Okay, thank you.